Now, as part of efforts to eradicate malaria in Ghana, government has launched the National Malaria Elimination Strategic Plan. The plan, amongst other things, aims at reducing malaria mortality by 90% by the year 2028 and to reduce malaria incidence by 50% going into that year. Launching the strategic plan, the sector minister, Agyemang-Manu, expressed his optimism that Ghana has the capacity to eradicate the disease considering the successes of the National Malaria Control Program.
Malaria has remained a priority disease under the government's policies and initiatives and has traveled several progressive milestones to ensure high coverage of evidence-based interventions to combat malaria through the National Malaria Control Program and now the National Malaria Elimination Program. The control program, for instance, aimed to achieve the following goals by 2020. 100% of communities will have access to community-based treatment for uncomplicated malaria. 90% of caretakers and parents will be able to recognize early symptoms and signs of malaria. And 90% of children under 5 years of age with fever will receive an appropriate anti-malaria treatment within 24 hours. On the other hand, the National Malaria Elimination Program was established to reduce malaria morbidity and mortality rates by 75% by 2020, using 2012 as a baseline. Some of the key interventions and strategies implemented by the elimination program include distributing long-lasting insecticidal nets nationwide through health facilities, communities, and schools, rolling out guidelines for malaria case management, malaria in pregnancy, laboratory diagnosis of malaria, and anti-malaria drug policy in all our regions. Conducting supervisory visits to public and private health facilities, monthly data reviews, routine data quality audits, and monitoring of activities of epidemiological sentinel sites. Indoor residual spraying in targeted districts. In 2000, we committed to the Abuja Declaration on rolling back malaria in Africa and the Millennium Development Goals, MDGs. And finally, in 2006, we also committed to malaria elimination in Africa. Distinguished ladies and gentlemen, we have made significant progress in reducing the burden of malaria in the last decades. With smart investments, strong and enduring partnerships, a dedicated workforce, and effective leadership, we have reached millions with life-saving interventions. Malaria-related deaths at all ages reduced from 3,889 in the year 2008 to 155 by the end of 2022, which is about a 96% reduction.
Director General of the Ghana Health Service, Dr. Patrick Kumapaju, also stressed that the negative socio-economic impact of malaria makes it imperative for the country to eradicate the disease like other countries have done.
That the socio-economic impact of malaria has been said already is significant. The disease imposes a heavy economic burden on households, the health system, and the national economy. Malaria-related illnesses and deaths lead to lost productivity, absenteeism from work and school, increased healthcare costs, as well as personal costs. This can result in reduced economic growth and development. It is therefore the desire and wish of the government that the two committees will help avert the above impact by working hard to support the service and all other stakeholders to eliminate the disease. Distinguished ladies and gentlemen, let us all leave here with the conviction that all hands will be on deck, as was shown, to ensure malaria-free country. Let's remember that zero malaria starts from me and you. We all have a role to play, and I will urge you to put on your best effort to make it possible, as the government also does its part. We have done it before for guinea worm eradication, and we can also do so for malaria.
Or representing the presidential advisor on health, Dr. Nsia Sari, mentioned that this plan wouldn't just sit on the shelves, adding that government has the political will to ensure the full implementation of the strategic plan.
A more robust partnership is required to end malaria once and for all in Ghana. I'm abreast of the multi-sectorial engagements that culminated in the development of this National Malaria Elimination Strategic Plan. I'm happy about this effort and commend the various sectors, ministries, and agencies who avail themselves to contribute to this document. The National Strategic Plan will be a guiding document which seeks to build on the progress the country has made so far. The plan, which is built on inclusiveness, sustainability, empowerment, and resilience, clearly defines the strategies necessary to accelerate progress from malaria control to malaria elimination. I therefore call on all sectors, ministries, agencies, both public and private sectors, to fully take ownership of the document and together work with the Ministry of Health and the Ghana Health Service to fully implement the plan activities. The approach the nation intends to use is a subnational elimination approach to achieve malaria elimination in a stepwise manner. Ghana is characterized by varying disease levels elimination, which will target areas of lower malaria levels to those of higher levels. I'm confident that this plan will guide the nation into zero malaria. I know it is a monumental task. However, considering the progress made so far in recent years and the efficiency of the interventions at our disposal, we are well able to accomplish the goal we have outlined ourselves as a country. I take this opportunity, therefore, to assure you of government's commitment in providing the political will and the resources to support the deployment and implementation of the various strategies and elimination activities. Government is ever prepared to play the necessary leadership role for malaria elimination in Ghana. In launching this path to elimination, private sector involvement is very imperative in addition to government support. Private industry investment is critical in realizing the malaria elimination goal and to help build stronger health systems. Innovative mechanisms are required to mobilize resources domestically and internationally to augment existing resource streams, including donor contributions, thus closing the national funding gap which the program manager spoke about.